Good evening. Good evening to all. I'm just waiting for 5 p.m. nowadays. 4:59. Okay, it is fine now. I go very fast. Anyway, you can see the recorded videos. I just give a quick revision as much as possible. A person giving false evidence under oath will be punished under. And you see, these three sections is nothing but definition. Number 191, that is perjury, giving definition of false evidence in a court of law. This question asked about 2 to 3 times repeatedly in last 3 years. Okay. 192 defines what is fabricating false evidence. 197 defines what do you mean by issuing or signing false certificate. Remember, all three together is punished under section 193 of IPC. Maximum up to 7 years of imprisonment can be given. Okay. In case of civil negligence during malpractice, the onus of proof lies on. This is also a question asked in the last NEET. And you know very well, who has to prove the doctor negligent? Why should doctor has to prove that you are negligent? The negligence has to be proved by the patient himself. The patient has to prove, not anybody else. The patient has to prove, not the hospital, not the lawyer, not the doctor. Okay. Now, what is res ipsa loquitur? The res ipsa loquitur means the thing speak for itself. The thing speaks for itself. Say for example, here, if a doctor prescribes an overdose of medicine, or if he keeps a surgical instrument inside the body cavity, absolutely no defense for the doctor. Absolutely no defense for the doctor. And look here, it is very, very simple. All the following conditions of defenses are liable to a doctor against allegations of negligence, except res ipsa loquitur. Res ipsa loquitur means the thing speaks for itself, absolutely no defense for the doctor. Okay. Now, here, another most important, what is contributory negligence, also known as concurrent negligence, and here, both the doctor as well as patient are negligent. Both are negligent. Remember very well, it is only in civil cases. That means only for suits for damages, only for compensation, not for any criminal negligence, only for civil suits. Remember that. For example, here, many students I have seen, 50% of the students, they don't answer for this question. You look here, law does not consider in criminal negligence. As I said, it is only in civil case, that is contributory negligence is the answer here. Okay. Responded superior, repeatedly, I was telling continuously. Just remember only one point, that employer is liable to pay the compensation for his employees' negligence. Employer is responsible to pay the damages. Damages means the compensation for his employees' negligence. And here, never ever write responsibilities for the action of junior. Most of the students, they write responsibility for action of junior. That is wrong. There is nothing like senior and junior. Here it is nothing but employer and employee. Okay. Now again, as I told here, it is only for the payment of damages. Damages. What is damages? That is compensation. Again and again I am telling, damage means harm, damages means contribution. Law does not consider the following doctrine a charge of criminal negligence. And again here, answer is vicarious liability. Now we have come to know both contributory negligence as well as vicarious liability only in civil negligence, not in case of criminal negligence. Now, in case of PGI, if at all they ask like that, and already I mentioned, I don't want to waste the time, the answer is contributory negligence and vicarious liability. Okay. Now, here, medical council, again, don't get confused between warning and warning notice. Now, I highlighted warning notice means code of conduct. It is issued by the medical council to all the doctors at the time of registration. And if at all you don't follow the code of conduct, then disciplinary action will be taken by the medical council. And now, even today, one student asked me a question that some modification is there of the National Medical Commission, and see here. Now, initially I was telling there are only two disciplinary actions, that is warning and penal erasure. But now there is one more thing called monetary penalty. So maybe fine also can be imposed by the National Medical Council. Or else, as I used to teach before NMC, only two, warning and penal erasure. And now, here, this you know very well, the temporary permanent is also known as provisional death sentence. Now, whom he can appeal? I always used to say, appeal should be done to the Central Health Ministry, but now it has been changed. Now it has been changed. First appeal to the Ethics and Medical Registration Board, and if again doctor is not happy, he can do second appeal to National Medical Commission. Remember, Ethics and Medical Registration Board also comes under NMC, but it is one wing under NMC. Okay. Now the question of Central Health Ministry will not come. At the same time, anytime in India, doctor can appeal to High Court and Supreme Court. That is common knowledge. Okay. So now if the question asks, the appeal can be done not to the Central Health Ministry, it is the National Medical Council. Remember that. Now, for example, here a doctor can appeal against disciplinary action taken. It is not Central Health Ministry, but earlier the answer was Central Health Ministry. Okay. Yes. Vicarious liability is same as respond. Vicarious liability is under the principle of respondeat superior. That both are same. Okay. One part of vicarious liability. Now, what is the disciplinary action taken? Penal erasure, not the warning notice. Again and again I tell, it is not warning notice. And now here, warning is the disciplinary action. It is given to the unethical practice. Warning notice is issued not for unethical or wrong diagnosis, wrong treatment. It is none of the above is the answer. So the following is the disciplinary action for professional misconduct. Penal erasure, yes, only penal erasure, because here it is mentioned warning notice. If penal erasure and warning is there, now the answer is both. Answer is both. Okay. Now, these four sections you should know very well. 336, rash and negligent act endangering life of a person. 337, rash and negligent act causing hurt. 338, causing grievous hurt. 304A, causing death, where up to 2 years imprisonment can be given. Okay. A doctor injects medicine without giving test to the patient dies. Patient dies, but he died due to myocardial infarction. Remember, here doctor has not given test dose. That means he can be punishable for a criminal offense under 336 of IPC, endangering the life of the person. But compensation will not be given because death is not due to the negligence. Okay. At the same time, in this question, there is death of the patient by anaphylactic shock. Death of the patient by anaphylactic shock. So in such cases, he will be charged under 304A IPC for causing death of the person. At the same time, because death is due to his negligence, claim can be asked by the nearest kith and kin. So the answer is charged for both civil as well as criminal negligence. Okay. Now here, because of COVID, now as of now the COVID, there are 3 sections you should remember. All these already I discussed. Now again I say negligent act. Say for example, without wearing mask, if you move around in the mall or in the public place, then it is a negligent act. Knowing very well that you are COVID positive, if you move around, then it is a malignant act, 269 and 270. And if you don't abide by the law of quarantine rule, then it can also be punishable under section 271 of Indian Penal Code. 270. Disobedience to quarantine rule. A person present with crush injury of both lower limbs in an emergency and refuses to consent for surgery. See, I remember most of the students think, you know very well, 92 IPC deals with emergency consent. That means person is in emergency, remember, but is not in a position to give consent. How? Maybe by unconsciousness. Number 2, person is intoxicated. Number 3, person is mentally ill. Only such cases, no need of consent in case of emergency. But here, patient is conscious, he refuses surgery. That means doctor cannot operate on the individual. Doctor cannot operate on the individual. Poison which can be detected even in exhumed decomposed bodies. See, strictly speaking, all heavy metals resist putrefaction. So out of all these, the best answer is arsenic. Which are the poison which resist? And here, there are so many poisons which resist putrefaction, especially the phosphorus, organophosphorus, endrin, strychnine. You should remember this. Okay. And all heavy metals. See here, I say heavy metals like arsenic, antimony, mercury, lead, thallium. But here you see, mercury is also given in the option. But out of all, the best answer is arsenic. Arsenic is the best. Okay, remember that. Okay, I just give one list. What is Magnus symptom? All of you know what a Magnus symptom? That is tactile hallucination seen in case of cocaine poisoning. That is also known as coke bugs or cocaine bugs. And remember here, in case of cocaine poisoning, it is associated with delusion or persecution. Delusion or persecution. And it is also seen in so many other condition like amphetamine. In amphetamine is known as methmoids, also seen in alcohol withdrawal, arsenic poisoning, and ergot poisoning. Okay. Invisible tattoo. Tattoo, there may be several questions. Now, let me say, which is used for corneal tattoo. Gold chloride or platinum chloride is used for corneal tattoo, which give rise to jet black stain. Okay. Latent tattoos are invisible tattoo marks which can be made visible by ultraviolet rays. Latent means invisible. Answer is ultraviolet rays. But if it is old tattoo, means faded tattoo, it can be made visible by infrared photography. And in case of dead body, you can take the regional lymph nodes for biopsy where you can see the pigments of tattoo. Best method to remove tattoo is laser. Best method to remove tattoo is laser. This question asked in the last NEET, all of you know, in case of children, the hymen is situated posteriorly, means it is deeply seated. So, and also it is very difficult to insert the male organ into a child vagina. So here the answer is it is deeply situated. And here I would like to tell posthumous child is one of the expected question. Posthumous child means not after the child which is born after the death of the father. Strictly speaking, it is born after the death of a biological parent. After the biological parent. Here you ask Sagarsh, why can't answer is C? I don't know which is the question you are asking about. Okay, so tell me which question you are asking about. A child born after the death of a biological parent. But see, normally it is after the death of the father, but sometimes a mother is almost about to die, brought dead to the hospital, and if she is found to be pregnant, immediately can remove the baby by cesarean section. But that condition is rare. So here, posthumous child is a which is born after the death of the mother or father or both. Okay. Yeah, PDF we give, okay? We give the PDF. Not the PDF, recorded video we give, okay? Posthumous child is a child, maybe A or maybe P. Okay, tattoo. See, individual tattoo during autopsy can be detected. Why? See, region by it takes time. So if it is there, oh here you know, you mean to say during autopsy. Okay, you are right. Yeah, during autopsy. In case of dirt, actually correct. But if you compare both, if ultraviolet rays is not there, the provision is not there, then you can go for regional lymph node attacks. Otherwise, ultraviolet rays immediately can identify. So out of these two, best is ultraviolet. Okay, maybe the mistake in the question also. I'm sorry. Okay, but out of these two, the best easy method is ultraviolet. Okay. Now, here again, always students say, because Williams obstetrics say, abortion means termination of pregnancy before viability. So many students say before 28 weeks. That is wrong. That is wrong. So here, anytime as per law, abortion means termination of pregnancy at any time before full term. Remember that. Okay. Now, medical termination of pregnancy Act, then there is an amendment bill. As of today, it has been passed in the Lok Sabha, and also some 2-3 days back it has been passed in the Rajya Sabha, but it has not been signed by President of India as of now. But 100% before your exam, it will be signed by the President and it will come in the Gazette. Then it becomes Medical Termination of Pregnancy Amendment Act 2020. All these proposals have been will be implemented. Okay. Now we see so far it could be done only up to 20 weeks, but after 12 weeks one RMP opinion, but now up to 20 weeks one RMP, 20 to 24 2 RMP. But remember, pregnancy can be terminated after 24 weeks only in case of number 1, survivors of rape, number 2, victims of incest, number 3, differently abled women, and number 4, minors less than 18 years. And one more modification is, previously the failure of contraceptive only in married women, but once this act comes, woman or any person, whether she is married or unmarried, contraceptive failure or contraceptive failure in the male partner also, termination can be done. Okay. Now here, bill contraceptive failure in anyone. Okay. Rajya Sabha passed. Yeah. Now, what is exactly the difference between 376-2? 376-2 says custodial rape. Remember the custodial rape 272. That means if a police officer or hospital superintendent or anybody in a position of trust rapes a woman in his custody, it is custodial rape. Whereas 376C is not rape. It is sexual intercourse by a person who takes advantage of his official position and has sexual intercourse with a woman. It is not rape. She gives consent. Say, for example, person may say, if you agree to have sexual intercourse, I will promote you. That is 376C. That you know very well. No, fetal abnormality, it is not mentioned. It is not mentioned. That time it is only up to 24 weeks. Up to 24 weeks, okay. But after 24 weeks, again, you have to go to the court of law. Okay. And punishment also, you see, 10 years and you have 5 to 10 years. See, your answer should be depending on the question. Depending on the question. If they ask a bill before your exam directly, definitely it will be passed. So, answer should be 24. Okay. Okay. In old one, no, old one will be changed because your exam is on April 18. Another 1 month, it will be passed. Okay. Don't worry about that. Now, these 3 sections you have to remember. Very, very important. As per POCSO, anytime any offences under POCSO Act 2012 should be informed to police. Number 2, 357C, hospital should provide free treatment for rape and acid attack victim. And 228A of IPC, you should not disclose the identity of the victim of the rape. Okay. Most widely used illegal drug all over the world or even in India is cannabis. Cannabis. Okay. Legal drug, which is most commonly used legal drug in India, that is tobacco. Tobacco. Okay. According to Mental Health Act, what is the maximum duration possible for voluntary admission? So here answer is 30 days, and if at all the question asks at a stretch for 10 days and maximum 30 days, at a stretch for 10 days, maximum 30 days. So here the answer is 30 days. Okay. So here, in case of suspected sodomy, an inner swab was taken and on staining yellow needle-shaped crystals of picrate were detected. Which test is done? Now, I tell you some points in semen. Same answer I will give here now. What is 100% confirmation semen? Number one, presence of sperm in the microscopy. Number two, sperm-specific LDH isoenzyme. Sperm-specific LDH isoenzyme. 100% detection of semen. What are the presumptive signs? Number one, you pass UV light, then you see blue-white color. Okay. Remember, most common test used for screening for semen is acid phosphatase test. Now you see, yellow needle-shaped crystals are seen in barbarous test by the presence of sperm in picrate. Whereas fluorescence test, you can remember choline iodide, which give rise to dark brown rhombic crystals. So you can remember like barbaropicrate, BP, barbaropicrate. Okay. This is another important point. Which test is used to find both choline and spermine? Thin layer chromatography. Both choline as well as spermine. And creatine phosphokinase is the best for old stain even up to 6 months. Okay. Okay. Yeah, Disha, you are right. Okay. Now, for blood, which is the best test? Some people used to say phenolphthalein test or some other test. No, remember, as per Anil textbook, the best screen test for blood is luminol test. Luminol test. So, which test is used even in case of washed blood? If the floor is totally washed, then also you can see the blue hue when you use the luminol. That is the best screening test. Okay. Okay, you can remember like BNP, no problem. Only thing you have to remember, that's all. Okay. And here you see, it can be detected even minimum up to 7 weeks. Even up to 7 weeks, you can see. But more than that, not exactly how long. Okay. Now, Sneha, you are asking about spectroscopy. Let me tell. This is screening test. Screening or presumptive. Now, blood. Spectroscopic examination, as you say, is the best confirmatory test in both recent as well as old stain. Of course, you can do microscopy, but microscopy should be done as early as possible. Then you can do spectroscopic, that is for confirmation. To know the grouping of old stain, there are 3 tests known as acid elution or absorption elution or absorption inhibition test and lattice crust method. Lattice crust method. At the same time, best test to know age of the stain is immunoelectrophoresis. Immunoelectrophoresis. And remember, precipitin test is not specific for the blood examination. It is a species specific test. Precipitin test to know whether it is human or not blood or not. If it is blood, whether it is human blood or not. If it is monkey blood, whether it is monkey blood or not. Okay. Now, what is it? See, you can see the somewhat green discoloration with blisters, putrefaction. It is nothing but putrefaction, and here the answer is decomposition. And putrefactive blisters contain air or gas. Okay, air or gas. Why Sangarsh? What confusion? No confusion. What I am talking about is confirmatory test. Confirmation test means 100%. presumptive or screening. You can screen, that's all. Okay. Now you see the difference. The second one is burns. You can see water reaction in the form of reddish discoloration can be seen. Reddish discoloration, and there is blisters. You can see. I will show you the next slide. Okay. What is the suggestion of antemortem death in burns? Many people say heat hematoma. Heat hematoma, wrong. Heat fracture, no. Heat rupture, no. You know why? There are only 3 definite signs of antemortem burns. Number 1, soot in the trachea. Number 2, the blisters. You can see the blisters containing the chloride, albumin, RBC and WBC, and more than 10% carboxyhemoglobin in the blood. Okay. Okay. See, no need to bother whether it is old or new. You know why? Spectroscopic is best even fresh stain as well as old stain. See, old, it is somewhat subjective. It is not exactly said. Old means what? Maybe one day old we say. How old are you? I ask you. Your grandfather also I ask, how old are you? So old is subjective. Okay, Anusha. Okay. Okay. Now, you should know how to differentiate between filigree burns. Filigree burns is seen in case of lightning. It is due to the rupture of the RBC. It is not a true burn. And you can see branches of tree-like appearance. Branches of tree-like appearance. And upper photo show you the filigree burns. Lower photo show you marbling. Marbling means staining of the walls of superficial veins by sulfate hemoglobin. Sulfate hemoglobin. Okay. And see, the first one is branches of tree-like appearance. It looks like a capillary network. But marbling, what you see, lower 3 photos are venous network, which becomes prominent in 36 to 48 hours. A patient comes with black discoloration of the post-auricular region. The sign is called battle sign. Okay, here again there is some confusion. Some book says battle sign is due to the fracture of middle cranial fossa, but majority of the books say nowadays it is fracture of the posterior cranial fossa. Strictly speaking, it may be seen in both fracture of middle cranial and posterior cranial fossa because it comes petrous temporal bone. If it just crosses, then there will be a fracture of posterior. If you have to select only one, then I prefer you to choose fracture of posterior cranial fossa. What is the maximum age of a person by the analysis? And most of the time they go on asking about carpal bones. I will show you a picture now here. The same picture I will show you. You can see I will go a bit fast. The first one to appear is capitate at the age of 2 months. Then hamate at the age of 3 months. Then comes the triquetrum. Tri means 3 years. Lunate 4 years. Then scaphoid, trapezoid at 4 to 5 years. Pisiform is the last bone, 9 to 12 years. 9 to 12 years. Okay. Now, 1-year-old child will have how many carpal bones? 2 months and 3 months. That means 2 bones. 2-year-old child will have how many bones? Same. 3-year-old child will have tri means 3. 3 years. 3. 4 years. Lunate comes. Then 4. Then 5 years. Another 3 bones will come. So totally 7 bones will be there. And finally, a 12-year-old child will have 8 carpal bones. 8 carpal bones. Okay. Now, sometimes you get confused whether pisiform is appeared or not. That is because always pisiform overlaps over triquetrum. Then you can see the double density. You can see the double density. You see here a double density. You see here a double density. If I enlarge, you can see overlapping of the bone. You have to look into that. Now, what is the predicted bone age from the wrist radiograph given below? Pisiform is not there. Pisiform 9 to 12. So age is less than 12 years. So here best answer is less than 15 years. What is the maximum age of the person? Here again pisiform is not there. So age is, but whereas other carpal bones appeared, age is more than 4 and less than 12. 4 to 12 is the age. So what is the maximum age now? The answer is 10 years. 10 years. Maximum age 10 years. 4 carbon bonds are there, you can say 4 years. Okay. Now, what is the age of the individual? 3. Trichitrum appeared. 3 years. What is the maximum age of the individual? Only 2. Capitate and hamate. Both appears before 1 year, but 2 years there is no. So what is the maximum age? It cannot be 3 years because trichitrum not appeared. The child may be 1 year, but maximum 2 years, but it is not 3 years. Okay. Determine the age, absolutely no. The answer should be less than 1 year. Less than 1 year. What are the definite signs of antemotum hanging? All of you know the definite signs of antemotum hanging. Number 1, dribbling of saliva, 100%. But it is rarely seen. Okay. Amusard sign means tear in the intima of the carotid artery. Tear in the intima of the carotid artery, that is because of the stretching. Number 3, law phase is sympathetic. Strictly speaking, it is a myth. What they say is, if at all knot is on the right side, as you see here, right side, maximum pressure will be on the opposite side, and that side, if may press the cervical sympathetic chain, there eye may be opened. It means opposite side of the knot, eye may be opened and pupil is dilated. Just remember, wherever the maximum pressure, eye will be open. That is always opposite side. And I go a bit fast. Now, you remember, maximum injury to the neck is seen in case of throttling. What are the changes you can see? 6 penny bruises, you know very well. Under the 6 penny bruises, you can see ecchymosis, because you'll be go on pressing, extensive bruising of the neck muscles. Even intimal tear may be there because of the local stretching of the carotid artery. Hyoid bone fracture is more common in throttling. Your thyroid, cardiac, cricoid, tracheal rings also may fracture because the person will be go on pressing. Okay. So now, throttling, many times they ask in the AIMS exam, you see here, first picture you can see 6 penny bruises, then you should go in case of throttling. You can see the ecchymosis, bruising. This is a general sign of asphyxia, and there is some bruises under the lips. Maybe same person may be trying to close the mouth forcibly, then you can see. If at all the person the accused tried to prevent, assailant tried to prevent shouting, then there may be some bruises. So here best answer is throttling. And you remember, in case of hanging, the ligature presses over the hyoid bone. It presses against the cervical vertebrae posteriorly, anterior ligature, antero-posterior compression fracture or abduction fracture, commonly seen in hanging. Inward means the person straight away press the hyoid bone here, throttling, most common in throttling. Okay. Now here you see, most of the students say that the answer is cafe coronary, but remember, in cafe coronary, absolutely no signs of asphyxia. To say cafe coronary, say for example, I just take the food denter, suddenly I collapse, I died down. Finish. No signs of asphyxia. But here, signs of asphyxia are there. So it is not cafe coronary. Here the answer is, what in eyes? Eyes is pedicle hemorrhages. The pedicle hemorrhages is general sign of asphyxia. Okay. Traumatic asphyxia means, remember, there is trauma to the chest. A heavy weight falling over the chest. Then you can see multiple pedicle hemorrhages, cyanosis, and a clear-cut line of demarcation. Traumatic asphyxia, there is trauma to the chest. Positional asphyxia, there is no trauma to the chest. Air entry into the lungs is inhibited by weird or unusual position of the body. Say for example, this child totally flat, so it may die. That is positional asphyxia. In jackknife position, say in case of jackknife position means knee chest position, not exactly knee has to touch the chest. So here what happens? The process of respiration may get compromised and person may die of positional asphyxia or postural asphyxia. So jackknife position may cause death by positional asphyxia, especially whenever this jackknife position is prolonged. At the same time, even if I go and press here, forcibly press. This is also jackknife position now. Now the female may die of traumatic asphyxia. Traumatic asphyxia. So the word jackknife position is associated with both. But in surgery it is given because of the prolonged jackknife position. Whenever it is prolonged, your answer should be positional asphyxia. But in surgery, surgeons, they refer Bell and Love, there it is given position. Both are given in the option. If you have to select one, I suggest you to write the answer positional asphyxia. Yeah, intimal tear may be seen in hanging because of the stretching here, local stretching. Okay. What are the different signs of antemortem drowning? I go fast, you know very well. Then number one, cadaverous fast, 100%. Number two, emphysema causum, drowning lung. Number three, copious amount of white fine leathery froth, emphysema, that is due to emphysema causum. Number four, Paul-Toff's hemorrhages. These four you can see about definite signs, but datums, the medical legal importance is controversial because all of us may have datum in our body, but if the datum present in the body is same as the datum present in the drowning media, then only it has got medical legal importance. But it is not a conclusive sign. For example, here you see what is the conclusive evidence of death due to drowning. Don't write datums as your answer. Don't write datums as your answer. Okay. Now you see how to differentiate the injuries. This is a lacerated wound. How we can say lacerated? See, whenever you see these neurovascular bundles, immediately you can say it is a lacerated wound. And at the same time, you can see margins are contused. At the same time, edges are irregular. Edges are irregular. It is a lacerated wound. Okay. See, size, it may be very minute to few centimeters in size. Okay. Sneha. Now you see, as soon as you see, you can say that it is a lacerated wound because you can see the tissue bridges. Here, you see the margins are regular, edges are not considered. It is an incised wound. It is an incised wound. Now you can see abrasion or contusion at the margin. That means it is caused by a sharp cutting, heavy weapon. You see the margins are regular. That means it is a chop wound. It is a chop wound. And now we can see the margins are regular, edges are abrated or contused. It is a lacerated wound. It is a chop wound. There is no neurovascular bundles. Okay. Now you see, again in lacerated wound, when it is happening over the skin underlaid by the bone, it looks like incised wound. These are known as incised looking lacerated wound. Incised looking lacerated wounds are seen over areas underlying by bone, like chin, zygoma, eyelid crest, etc. At the same time, there is lacerated looking incised wound. Remember, incised looking lacerated wound I showed you here. What is lacerated looking incised wound? See here, wherever incised wound takes place over wrinkled and loose areas like the neck, axilla, back of the elbow, scrotum, if there is an incision, the margins may look irregular. That is known as lacerated looking incised wound. Okay. This is stretch laceration caused by tangential force. Tangential force, you get stretch laceration where you can see beveling. Here you can see beveling. That is stretch laceration. This is above downwards. See, above downwards. Oblique. Below upwards. Oblique. Stretch laceration. Okay. Avulsion, like you remove the dosa or chapati from the tawa, entire skin comes out, usually along with subcutaneous tissue where you can see underlying muscular fascia or sometimes directly bone where there is no muscle like anteromedial aspect of the leg. You see only the bone. Okay. Now, sometimes there may be one additional split additional split you can see in a lacerated wound, that is known as swallowtail. Swallowtail. Because the swallow bird, the tail comes like this, the swallowtail. Peeling of the wound, incise wound. As the weapon go away from the skin, it becomes more and more superficial. You can see only the scratch abrasion. That is known as peeling of the wound. Sometimes in case of stab wound, caused by a kitchen knife, means single-edged knife, the blunt edge may tear the tissue in the shape of the tail of the fish. That is known as fish tailing. Okay. See, chop wound margins show ecchymosis. No, not ecchymosis. Ecchymosis is different. Here especially better use the word abraded or contused. Incise wound, no abrasion or contusion. This is fish tailing. Now again I show you. This is swallowtail, lacerated wound. Swallowtail seen in lacerated wound. Tailing of the wound seen in incise wound. And fish tailing seen in stab wound by a single-edged knife. The most likely organ damage in blunt abdominal trauma. See, I tell you, if this question comes in part B, you have to write liver. Liver. At the same time, surgery teachers or surgery books say most common organ is spleen. If it comes in part C, then you write spleen. Okay. Which is the chamber most prone? You have to use your anatomical knowledge. Maximum surface area, what you see in the heart is right ventricle. So, right ventricle is most prone to penetrating stab injury. Okay. See, penetrating, perforating, there is nothing, I tell you. If a stab enters into a cavity like cranial cavity, thoracic cavity or abdominal cavity, it is penetrating wound. If it comes out from the other side of the body, that means wound of entry and wound of exit, then it is perforating wound. Okay. Out of heart chamber, bleeding is comparatively less in which case? See, thickest is left ventricle. Thickest is left ventricle. So once the ventricle wall is very thick, gaping is less. So comparatively less. Okay. Left ventricle. Okay. If there is no part C, are you sure that there is no part C? Then I don't know what exactly to answer. Whether it is coming from forensic medicine or general surgery, I don't know. But always we say, all our books say that liver, liver, liver. Even in our experience also it is liver. What is the commonest organ involved in penetrating abdominal injuries? Again here, surgery people say, surgery books say that liver. But how can it is liver? See, liver in the abdomen, only this much is visible. Or maximum portion what you see is small intestine. Our answer is small intestine. Our answer is small intestine. Okay. Remember some few points. I finish in another 2, 3, 4 minutes. All acid cause coagulative necrosis except hydrofluoric acid. That is very, very important. Hydrofluoric acid. Whereas alkali always cause liquefactive necrosis. Alkalis cause liquefactive necrosis. This is very, very important. Frequently they ask about this. And in corrosives, generally they say no singeing, no red line and no blisters. But I have seen a reference in formic acid there may be blister. Okay, remember that. Hydrofluoric acid, repeatedly they asked previously, it causes tissue necrosis and destruction because it causes liquefactive necrosis. There is severe throbbing pain and also there is acidosis, hypocalcemia, hypomagnesemia, hyperkalemia. Boy heard this, boy heard this, boy heard this. Very, very important. Very, very important. In poisoning by nitric acid, the color of the stomach, because most of the people say yellow, but yellow is wrong. Yellow is skin and mucous membrane other than stomach. In stomach what happens? The formation of acid hematine. So it becomes dark brown because of acid hematine. In case of lead poisoning, chronic lead poisoning known as plumbism, there is increased metaphyseal density not because of the deposition of lead. It is because of the deposition of calcium. Okay. Gun wound is small intestine. It depends where exactly the gunshot enters. Okay. Now, this I just show you various ranges. If the person at distant range, you can see only abrasion collar and grease collar and wound of entry. In case of intermediate range, in addition to abrasion collar and grease collar, because if the person is here, abrasion and grease collar wound of entry plus tattooing, as you see. In case of near shot, if the person is here, wound is similar to intermediate shot, but in addition to that, there is blackening. But normally they don't give the photograph of close shot because singeing of the hair and burning of the skin is not seen. And contact shot, tight contact, you see muzzle impression. Okay. And in case of shotgun, up to 2 meters, you get a single wound of entry, and especially from 30 centimeters to 100 centimeters, you see rat hole wound of entry. Rat hole. That means the margins will be more irregular. 2 to 4 meters, you see a main wound of entry as you see here. In addition to that, there will be satellite wounds. More than 4 meters, multiple wounds of entry can be seen. And lastly, you know what is the difference between lead snowstorm? Lead snowstorm means unjacketed bullet or semi-jacketed bullet or even dum-dum bullet or hollow point bullet. By hitting or not, by not hitting the bone, the bullet gets fragmented into multiple pieces. On an X-ray, you can see different shape and size density, that is known as lead snowstorm. Whereas bird shot is seen in shotgun, because if the size of the pellet is around 1.75 millimeter to 6 millimeter, the pellets are known as bird shots. We can see equal size and shape. That is bird shot. Okay, equal shape and size. I enlarge the photo. You can see lead snowstorm, different size and shape, and here equal size and shape, that is bird shot. And negative autopsy and obscure autopsy, I tell you in brief, negative autopsy, absolutely no findings. Cause of death cannot be given. Even after chemical examination, histopathological examination, postmortem examination, no findings, negative autopsy. Obscure, minimal findings will be there. There may be some aberration, there may be some contusion over the body, but otherwise, no opinion can be given. In both the cases, opinion as to the cause of death cannot be given. Cannot be given. Okay. Now, if the cause of death is unknown, even after detailed examination, it is known as cause of death is unknown. Even after detailed examination, investigation, it may be negative, may be obscure. No findings, even after detailed examination and investigation, no findings, then the answer is negative autopsy. Minimal findings but cannot correlate with the cause of death. Now the answer is obscure autopsy. Okay, obscure autopsy. What is n-mass removal? Remember here again, n-mass or n-block means that n-mass or n-block means all together. Gon's technique is block by block dissection. So whether it is n-mass or n-block, and I have a proper reference from Banana, the answer is Lettuce method. Okay, answer is Lettuce. And wish you all the best. Don't take any tension. Be cool, as I say always. Okay. Bye-bye. Wish you all the best. Okay. Okay, bye-bye.